Hello, everybody. Yesterday, when I was doing a live on India and China, one of our viewers said that I should start doing monologues. And that's not something I've done so far. I've usually written columns and, of course, hosted shows here and even on other platforms of, general discussion shows. But it was felt that maybe it was time for me to do my monologue. So I said, why not? Let's give it a shot. So happy Teachers Day. And today is a great day to bring this news to you because I found it very moving and wanted to share it with all of you. Basically, today, Chief Minister Yogi Adityanath has just made a big announcement that is set to transform the lives of lakhs of education workers in India's most populous state, Uttar Pradesh. And it couldn't come on a better day because from today, onwards, all teachers, whether in primary schools, upper primary schools, or government-aided institutions, will be entitled to cashless medical treatment. But this announcement doesn't just stop there. It extends to Shiksha Mitras, contractual instructors, and even the cooks who prepare those midday meals for lakhs of students every single day. Altogether, this decision is expected to benefit about 9 lakh families across the state. Now, why is this such a landmark move? And why am I, talking about it on this first monologue? It's really because healthcare costs in India remain one of the single biggest causes of financial stress. According to the National Health Accounts, 65 to 63% of healthcare spending in India still comes directly from people's pockets. In rural area, the figures are even higher. That means a single hospital bill can wipe out a family's wages and their earnings and push them into debt. For teachers and support staff, especially those on the lower paying scale or those on contracts, this has been a persistent challenge. By introducing a cashless facility, the state government is changing the equation. It ensures that whether you're in Balia or a Shiksha Mitra in Barabanki or a teacher in Gorakhpur, if you fall ill, you no longer have to worry about arranging money before you can get treatment. You can simply walk into an empaneled hospital and receive the care that you need without stressing out your family or your financial situation. This is about equity. For decades, permanent government employees had these rights, but contract workers, who actually are the backbone of government schools, were left out. Now, bringing them under the same umbrella sends a strong message that their service and dignity matters just as much as that of the regularized employees. Let's also remember that Uttar Pradesh is the most populous state in India with over 23 crore people. Education workers directly touch the lives of millions of children every single day. Ensuring their health security is, in a sense, ensuring the continuity and strength of the state's education system. Healthy teachers mean better classrooms, more regular classrooms, and better classrooms and regular classrooms mean stronger futures for our children. This policy shift also aligns with the national program of universal health coverage, Ayushman Bharat, although that specifically focuses on lower income people. By extending cashless treatment to an entire professional community, that is, teachers, para-teachers, and support staff, Uttar Pradesh has set a remarkable precedent, and one on Teachers' Day. There are other states also who do this. Few of them, not all, but a few of them. However, these benefits do not extend to contract workers. And contract workers in government school systems really keep the wheels turning. So it's really about time that we got them coverage as well. So this is just not about an administrative decision. This is actually social investment. It recognizes that the people who teach our children, feed them in schools, and form the foundation of our education system need dignity, security, and care because they are indispensable. And trust me, I come from a state like Uttarakhand, where there's so much hardship that it's very often very difficult to even get teachers into the classrooms. So this is so important, and it couldn't come on a better day, Teachers' Day. So I really wanted to share this with you because we send greetings to old teachers on days like this and tell them about how they've changed our lives or empowered us for the future. And I just felt like, how are we empowering them? How can we empower them? And I think Uttar Pradesh has given us a very fine example of that. And that's really why I wanted to do this monologue. And I see some of you who have given comments. And okay, but you said you're from Bangladesh. Stop it now. I'm very much from Uttar Pradesh and Uttarakhand. My ancestors had some roots in Bangladesh. But nonetheless, thank you so much for joining me. Nearly 30 of you here. And this was just very random. But I just saw it on the news and I said, I've got to come in and talk about how this makes me feel, especially on a day like Teachers' Day. If you enjoyed this, do like, share, and of course subscribe, and also go ahead and do that, because then that means you want to hear more from me. So this is in many ways like a verbal or a column as opposed to a written one. So if I was to write a column, this is probably what I would have said. So fantastic. Let's see how this does, and we'll catch up soon. Thank you so much for watching, and bye for now.